6. Just got in my car. I am heading over to my hospital where I have an 8 o'clock appointment to get my COVID vaccine.
This morning, my colleague, Dr. Jen Ashton, a practicing gynecologist, waited to receive her vaccine. An essential frontline worker, Dr. Ashton still performs surgeries at her hospital.
I literally felt like I won the lottery.
I'll be home for Christmas.
Her joyful mood infectious. Some waiting, even breaking out into holiday cheer.
I'm right-handed, so I'll do left arm.
The relief of finally getting vaccinated, indescribable.
I just feel incredibly fortunate. I didn't realize until that needle was in my arm how much fear and concern I had suppressed all year as I continued to take care of patients. It was incredible. Thank you, my dear.
You are welcome. And now we're incredibly fortunate to have Dr. Jen Ashton, Chief Medical Correspondent, with us now. Jen, I know you've had a history of severe allergic reactions. How are you feeling just hours after taking the vaccine? Any side effects?
Physically, Juju, I feel totally fine. I do have a history of severe allergic reaction to food, and I had my EpiPen ready. Obviously, I was in a safe environment, and I was monitored for 30 minutes. And my risk of an allergic reaction was much, much lower than my risk of COVID. So for me, it was an easy decision.
Jen, there's also been a lot of controversy, though, about politicians, even younger, healthier ones, getting vaccines. And we all know that states are allowed to set their own priorities. But walk us through the federal guidelines on who gets the vaccine first.
Well, what the CDC said, Juju, is 1A, that's the first group, should go to residents of long-term care facilities, so nursing homes, and frontline health care workers. Then the CDC just out with recommendations about who goes second, group 1B. They are suggesting essential workers and adults 75 years of age and older. And essential workers, a big group, people who work in food, agriculture, transportation, first responders, education, and prisons. There have been some small subset of politicians, government officials, for whom national security deems them an essential workers.
And briefly, can you give us the context of a lot of those alarming headlines coming out of the UK about this new mutation of COVID?
The deep dive on that, Juju, is that viruses mutate for a living, so we should not be surprised to hear that there are new strains or variants of COVID. I just spoke to Dr. Anthony Fauci about this late last night, and he said we really have to use caution before we throw around a term like 70% more transmissible. Right now, there's no evidence that this has made COVID more lethal, and more importantly, at this time, there's no evidence that this jeopardizes the efficacy of the vaccine. But again, we will be following this long term to know not only about these strains and mutations and how they behave, but also to make sure that the vaccines stay well matched. Right now, it looks like they will, but it's definitely possible that we could see a situation down the road where we might need different vaccines, just like we do for the influenza virus.
Well, Dr. Jen, your insights are always essential. We're so glad you're feeling well. Thanks for joining us.
Thanks, Juju.